Hey everyone, my name is Kate and I completed the NeuroHab program back in 2021 after having a microdiscectomy performed by Dr. David Johnson. I've suffered with back pain pretty much since high school. I had toothache in my gluten hip region, which was likely nerve pain. The back pain would flare up and remiss every so often until I was a personal trainer, and I believe that was when I injured myself in 2015 doing the leg press. Over the years, I had plenty of opportunities to try multiple different remedies, including massage, acupuncture, physiotherapy. None of it really worked. In 2015, I was seeing the same physiotherapist for several months, multiple times a week, and after a very expensive deterioration, I was told by the physiotherapist that I was getting worse, which I knew, and that it would probably require surgery. However, given that I was paying this person several times a week to not see any benefit, I decided that I didn't trust him and I ceased treatment immediately just to monitor conservatively on my own. It wasn't until 2020 where I had a relapse or a flare-up that was pretty serious that I saw serious impacts on my day-to-day living and realized that I needed some kind of help. When I tried to explain to my doctor that I was in pain and I asked what could be done, I was kind of given a bit of a shrug and told, I guess you could see a physio, which is not helpful when my experience with physios up to that point was less than pleasant. And then finally in 2021, I went to my doctor and I said, I really cannot walk. So the tests that she had me complete, I couldn't even complete them to fail them, and I was told that she would palpate my back and see if she could notice anything, and she said, yeah, you're really tight, you just need a massage. 2 weeks later I had the microdiscectomy. By this point I was relatively miserable. There's something quite humiliating about struggling to put on pants and shower and to sit or stand or sleep. So when I started the NeuroHab program, I was beaten, dejected, relatively miserable, and really just hoping that I could have some form of quality of life. At the risk of sounding conceited and just showing a training montage, this is how I live now, so mission accomplished. After completing the NeuroHab program, not only was I able to move in any fashion, but I was able to move without pain and conduct movements that I have missed for years. Because you begin the program with a group of people in exactly the same position as you, there is a sense of relatability to the experience. So while I walked in humiliated that I was unable to do so many things, there is a sense of kinship with people that you're doing it with because you know they're in the same ballpark as you are. And the good thing about that is as you're progressing, you're also seeing people progress with you. And there's a camaraderie that you kind of build as a group when you're doing it together. Going through the NeuroHab program, I learnt a lot. First of all, I learnt that there are more than 0 people who do not see any benefit from the traditional therapeutic modalities. I was in a group of people who had pretty much the same experience as I did, and not for a lack of trying with physios and OTs and chiros and massage and foam rolling and Pilates, did not see benefit. I also learnt that people who do not see benefit from the traditional therapeutic modalities may see improvement from movement-based therapies like the NeuroHab program. And to that end, I learned what that movement program is, to use movement as medicine. Really eye-opening seeing a group of people come in with the same limitations and the same complaints and the same frustrations with the existing model of therapeutic treatment, and then slowly build on self-efficacy and functional movements and slowly increase to a level where we all walked out being able to do things that we couldn't before. And obviously I learnt how to handle flare-ups as they come and how to continue to live if back pain is to occur in a way that traditional modalities didn't offer and probably couldn't offer. And I've seen benefit. I'm almost 2 years post-op now, and yeah, I'm back to living and lifting. I think with my personal experience going through this whole process, the main advice that I could give to health professionals and allied health professionals is listen, and in some cases a scan isn't going to be detrimental. And if you don't have faith in your program and what you're offering your patients, then in what world are your patients going to? So when a doctor said, I guess you could see a physiotherapist, I wasn't really instilled with confidence at that point, and when a physio continued to manipulate me with no improvements and then told me that I should get surgery because his services weren't working, I think it's devastating to think of how many people are actually going through this each day. I think there is an immense gratitude that I have for this program existing, for the Functional Movement Training Center existing, for people like Dr. Johnson and Joe for creating this program and helping people. And I think it's about time that we start seeing this hybrid between fitness and lifting well and allied health and living well, because big box gyms have their place, and I guess physio centers and doctor practices have their place, but there's nothing to say that when we're looking at health from a holistic point of view that we shouldn't combine them. I think it was just quite revolutionary to think that I went to a CrossFit gym to receive rehabilitation for a spinal surgery that I had because a physiotherapist failed me. And if that sentence doesn't tell you that something is wrong with the way things are currently, then I don't know what will. Thank you so much for listening to my story, and I hope you guys have a lovely night.